So, working together towards mother-baby friendly care. So, according to the World Health Organization, 19% of under 5 deaths results because of inappropriate feeding practices, including formula feeding. So it has been correlated to formula feeding, bottle feeding. Although there are other factors, but ito yung nakita nilang correlation, formula feeding. Pag hindi binibreastfeeding, 25% more are likely to die from diseases like diarrhea. Okay? Kasi sabi nga ni ma'am, hindi nako-colonize yung good bacteria into the baby to protect the baby. So, nagtatae, 25% of them. And 4 times more are likely to die from pneumonia. So, ito yung mga common causes of infant deaths, no? They die from those infections. According to this demographic health survey naman, this was done in 56 countries in the past 10 years. The Philippines, sadly, has the lowest ever breastfed babies. Okay? O konti, masyado ang nagpapabreast. Maybe because ang daming factors na nag-i-impinge on our mother, especially media, yung mga commercials, na, ang proponent of artificial feeding. So, very influential din sa outlook ng mother. So, tayo yung isa sa pinakamalababa. 16% only of infants are exclusively breastfed at 5 months. So they may be breastfed at birth, but it has not been sustained. So up to 5 months only. And of those, 39% also are given infant formula for the first 12 months. So, diba, this, like I have said, this is the crucial time. These are the time when the baby is very at risk to die. Tapos, hindi pa sila binibreastfeed. Okay? And 13% have never been given the right to breastfeed. Okay? So, they were never given breast milk. Okay. So, the world, merong global, yung mga countries came together and nag-agree sila. And they came up with this, yung Millennium Development Goals for Health, which was supposed to culminate in 2015, last year. This was done in 1998, or 1988. Okay, 89, 88. And how many years is that now? It's now 2016. Saan, one of those development goals that this country signed or committed to was to improve maternal health and reduce infant mortality. Okay? So the Philippines is one of the signatory of this international commitment. Okay? So ang goal nun, eto na, to decrease the Millennium Development Goal was supposed to reduce infant deaths to 2/3, okay? At least 2/3 reduction of infant deaths. Ano ngayon ang nakita? National statistics of 2003, this is the national infant mortality rate, was out of 1,000 live births, 29 babies were dying. That's a lot of babies, 29, di ba? Ang infant mortality rate for Calabar Zone, okay, for Region 4A, as of 2015 is 6 something. But of course, wala namang kalahating baby, no? So, hindi pwede mong sabihin 6.5, isa at kalahating bata, alin kaya? Taas, baba? So, nasa 6 tayo. Ang medyo mababa pa doon sa sinet na goal sa Millennium Development Goal, which is around, I think, if I'm not mistaken, around 16 or 15. Sasabihin natin, ay 6 pa lang naman. Okay pa, di ba? Below pa doon sa nilagay na goal. So we achieved it already. No. You know why? These are still babies dying. And as early as first quarter of 2016, nakita nilagay namin sa graph, yung graph medyo steep ang pag-akyat. So when do you act? Pag tumaas palalo to, ibig sabihin yung rate, madami. No? You do not wait for some more babies to die. You need interventions. We need to act. Okay. Okay. So how do we do this? So there is a need to improve health and nutritional status of infants and young children para daw sa MDG, para maabot yung goal ng MDG. And ito yung sinasabi, exclusive breastfeeding, and hindi dapat matapos dyan. It should be extended breastfeeding. And you have living examples all over this room. Okay? Hindi nakakahiya magpasuso ng kahit malaki na, 'di ba? Extended breastfeeding, complementary feeding. Okay, we will be looking into what complementary feeding is, okay, later. Ito yung ating tandaan. Almost all children can be breastfed, okay? Only the very weak ones, may mga exceptions. For example, the sick ones, yung comatose or whatever, yun yung hindi pwede. But almost all can be breastfed. Walang exception na malaki. Decision to breastfeed starts in pregnancy. Even kung hindi pa pinanganganak, nagbubuntis pa lang kayo, sino po si buntis dito? Okay? Okay. Okay. Hindi pa ayong tinaas kamay. Okay. Ngayon pa lang, nagbubuntis ka pa lang, nagdi-decision ka na mag-breastfeed. It's not a decision that you make when you are in labor or when you give birth. It's a decision that you make now. Okay. And the health facilities provides opportunity to drive home messages to breastfeed with greater emphasis on health. Because these are structured, okay? Isa sa trust ngayon, because we were looking into the maternal deaths, ang daming deaths na nangyayari sa labas. Yung home deliveries, because of 3 delays. Delay to recognize na may problema pala yung panganganak o yung pagle-labor. The delay to transport it to the facility where adequate medical care or action can be given. And the delay, syempre, hindi nakarating. So yung dapat na ibibigay na medical management, na-delay din. So kung minsan, o kadalasan nga, dinugo na ng dinugo, pagdating sa ospital, kahit pa magbigay ng blood transfusion, namamatay pa rin. Kasi too late na yung paglapat ng appropriate medical action, okay? So we are pushing for facility-based deliveries. Now, it does not necessarily have to be a delivery in the hospitals. Actually, we are already training yung teams of doctors, midwives, and nurses in what we call BEMONC facilities. They are trained in basic emergency neonatal care, where ang purpose is for mothers to deliver in a birthing home. Okay? Na nasa community. Andun yung relatives niya, andun yung support system niya. For normal vaginal births. Wala namang problema, lalabas talaga at lalabas. Sabi sa akin, Doktora, why do I need to come to the birthing home or the birthing facility? Yung nanay nga sa tuktok ng bundok, 5 na anak, buhay naman, tatay lang o mag-isa lang nga ng anak. Buhay naman sila, they're healthy. I said, no problem, I'm happy with that. But what about those that you do not talk about anymore? Because something happened and it was too far away to access quality health care. They're quiet na somewhere else. We are talking about women na walang problema and they're very lucky. But what we as health workers are concerned are those na merong problema na nobody knows may problema na pala. Okay? Na dapat makapag-access ng tamang intervention. Like for example, some women, for the example earlier, that was vaginal birth after cesarean section. Okay? Most likely, there was no problem with the passage and adequate yung dadaanan. Yung pintuan, kayang lumabas o pumasok. Okay. But probably, usually sa first babies, malpresentation. Baka suhe, una paa, or transverse. And these are very dangerous. Hindi yan lalabas. Paano mo naman pahalang ka? Tingnan ko nga sino dyan, pwedeng maglutang na pahalang. Tingnan ko nga kung makalusot dyan sa pintuan na yan. Of course, kung maiksi ka, pululusot ka, di ba? But that is dangerous. Nobody does that. So it's the same principle, okay? We deliver mothers even after cesarean. Pag ang rason dun sa first ay hindi naman contraindicated or hindi bawal sa panganganak sa second and even the third and even the fourth. And I, as a practicing obstetrician, I would always go for what is closest to natural or normal. Kasi sabi ko nga, the more na pinakialaman mo, the more magpo-problema. Okay? So if you don't need to fix anything, di ba? If something is not broken, don't fix it. Right? But if something is broken, you need to fix it. Okay? So yun, ang message natin. And after delivering this in these facilities, we need to follow up the women, hindi na after 1 week or 2 weeks. We need to follow them up after 2 days. And then on the 7th day, to check both of the mother and babies if there are no problems. Because like I said, the first 3 days, crucial yun sa baby. Okay? Next po. Ay, sorry, nasa akin pala. Sanay ako may assistant. Okay. Sorry, this is a slide I borrowed. Medyo malabo. But, breastfeeding has the single largest potential impact on child mortality of all preventive interventions. So dito, merong insecticide-treated materials for malaria places, complementary feeding, zinc supplementation, Hib vaccine, clean delivery, etc., etc. All these have health impacts on babies to help them survive, no? Pero ang breastfeeding pa rin, ang pinakamalaki ang impact sa survival ng bata. So, ibig sabihin, it's the one with the most help to the baby to survive. Okay? So, hindi yung clean, etc., water sanitation, etc., antenatal steroids or whatever for preterm. Nakakatulong sila. Pero pag breastfeed mo yung baby, mas malaki ang chance na makasurvive talaga ang bata. So these are hard evidence that we cannot refute, okay? Okay. This is to support our drive to encourage mothers to breastfeed. Breastfeeding promotion could potentially prevent 250,000 child deaths due to pneumonia and diarrhea. Like we said, 2 infections that usually are the cause for babies to die, diarrhea and pneumonia. So, eto ngayon ang impact ng hindi nga breastfeeding, just promoting breastfeeding can save babies' lives already. Hindi pa mismo yung act of breastfeeding. Just promoting this advocacy is already helping us save future babies. At my figures, at least 250,000 babies can be saved by just advocating or promoting breastfeeding. Okay? So tayo will be agents of saving babies. Everybody in this room, when you advocate for breastfeeding. Okay. So, ito naman yung pinakita. National Demographic Health Survey of 2003. Ito yung sad truth. Babies delivered in facilities were found to be less likely to be breastfed. So yung experience ni ma'am earlier, the baby was brought to the... It's still happening now, especially in, I'm sorry sad to say, a lot of private hospitals. Kasi hindi namin masaklaw. di namin ma-penetrate kaagad kasi pag pumunta ka dyan, they have the right to privacy of their records. Unless you get a court order, di naman pwede yan, di ba? Mag-aaway-away kayo. So we need to find, yun ang challenge for us public health workers, to find a way to penetrate these hospitals that are still practicing this. And sadly, even some government hospitals still do this because it's so hard. It's so ingrained in health practitioners. Yung old way of doing it. It's so hard to change values and outlooks overnight. And you have to respect also our individual values, di ba? Hindi naman pwedeng, hindi ka sang-ayon sa akin, patayin kita. Di ba? Hindi naman pwedeng ganon, di ba? You don't, just because you don't agree with me, okay? So, kung hindi ka nagbe-breastfeed, patayin kita. Hindi pwedeng ganon. So you have to find other ways of, so it's a big challenge for us health workers, okay? And for all of us. So the DOH Mother Baby Friendly Hospital Initiative was conceptualized in 1992 to address this reality. So they had, this was in pursuant to Republic Act 7600, which was called the Rooming In and Breastfeeding Act. So as early as 1992, meron na talaga palang initiative. But what happened? Okay, so what happened? That initiative says all hospitals, government and private, with maternity and newborn services should have this, the 10 steps to successful breastfeeding, which was set out by UNICEF and WHO as a global criteria to be followed. And that this hospital should be accredited as mother-baby friendly. So those who were instituting this and practicing this, they were given recognition and accreditation. Okay. So the MBFHI, or Mother Baby Friendly Hospital Initiative, aims to facilitate and protect breastfeeding in private and public hospitals, help mothers and their babies start breastfeeding soon after birth. Okay. So late in 1990s, nag-peak yun. A lot of the hospitals were getting accredited as Mother Baby Friendly Hospital, and the breastfeeding initiative was gaining momentum. I saw that, okay? I was already a very young doctor. Huwag na yung computin kung ilang taong ka, ha? Basta yun, 1990s yun. Okay, so peak yun, and there was accreditation of already 1,427 or 83% of the 1,713 target hospitals and lying in then. So that was a good jump start, no? However, sadly in 2006, this initiative weakened due to non-compliance to the 10 steps to successful breastfeeding. Why was there non-compliance? There was also fault, some our politics are very, very, parang, sabi nga nila, weather lang, ano. So, kung hindi priority yan, kami nalilipat-lipat. So I'm now pushing to combat maternal death. Kung ang next ay hindi nakikitang priority ito, I can be reassigned. That's the sad part. So those very committed and passionate program managers then saw the decline and less support for their programs. Kung hindi naman ikaw popondohan, bakit ba makakapunta ba ikaw at mag-monitor? You cannot monitor these hospitals anymore. And these hospitals, nag-backslide na ulit dun sa, mas kikita pala yung hospital namin, let's just have this milk formula, mas kumikita yung hospital. So balik kami sa milk formula. So there was no pressure on them to continue that momentum anymore. So yun, nag-decline na. The UP retrospective study on MBFHI in 2006 took a look into this situation. So they went to 15 regions and went to 98 government and private hospitals. So itong nakita nila, these were the findings. 92.9 of participating hospitals sustained the accreditation. So they were still accredited. They were complying. Nandyan yung 10 steps, breastfeeding, sa wall and everything. But, were they practicing it? Ito na. 51.9% of this participating facilities, ito yung practice. Breastfeeding policies were being communicated only during orientation to respondents. There was communication, there was orientation to breastfeeding, pero walang connect sa practice, orienting. Okay. 42% only during meetings. So there was less commitment to it. Okay. Then 52% of the participating hospitals had lactation coordinators because we trained lactation coordinators to guide postpartum women, teach them, reassure them, show them how, and give emotional support to this so that masustain yung breastfeeding. But sadly, 63% of mothers assisted in initiation of breastfeeding within half an hour after birth. 63% lang sila. So not everybody was being assisted. And 52% of the mothers assisted after birth to breastfeed and maintain lactation only. So kalahati lang yung nakakatanggap ng support, and it still declined further. Yay. 60.2% of hospitals, eto na, allowed provision of milk formula in specific circumstances. 43% did not, ito yung good news kaya may check. Meron pa namang 43% who said no food and drinks allowed other than breast milk. But that was the minority, na less than 50% na lang, di ba? Okay. Ngayon, ano yung special circumstances daw na qualify nila na, wag bigyan ng breast milk, hindi pwede mag-breast milk si baby or mag-breastfeed si nanay. So they came up with these reasons. Babies were provided non-breast milk due to these reasons. Mother daw was incapable of breastfeeding or sick, 35.7%. Kaya yung sinasabing, wala ka na palang gatas, wala ka talagang gatas, so wag na, magbote ka na lang. Okay, that killed the breastfeeding initiative of the mother. Baby is sick, 21.4%. Remember, even when baby is sick, the baby needs the breast milk even more. Diba? So, ginawang reason yon para hindi mag-breastfeed. Mother refused to breastfeed kasi wala naman ngang support. And the orientation was lacking. And iba yung orientation not in the right direction. Not supportive and protective of breastfeeding. Ito yung masaklap, doctor's orders. Kano kaya rebate ni doc? Okay, sorry ha. But now, we have addressed that also because it's true. Money talks. Diba? And very influential ang mga pharmaceutical companies. They will do everything and anything to get their money's worth. So routine hospital practice to give water and sugar, 1.3%. That's why most of the time when I have deliveries, I hardly get a pediatrician. Sorry, unless there is a medical need for the baby. Because most of the pediatricians right now, unless alam ko na oriented sila sa EINC and breastfeeding, that's when I get them to attend to my babies. Otherwise, I have the danger of involving myself into a quarrel. Mag-aaway kami. Kasi i-orderin niya dun sa chart, pre-lactal feeding, water and, I don't know, sugar, whatever. And I will not agree to that. And then there will be conflict between me. No? Sasabihin niya, I'm the pediatrician, you're just the obstetrician. Di patay ako dyan. So, wala namang problema. Mother ang kadigit ng baby ko. Okay? 27% only yung mga health facilities na nag-foster ng breastfeeding support groups. the mothers require support, especially during this difficult period of her life, no? Pagod na pagod, nag-labor, buntis at lahat. Tapos magbe-breastfeeding. Sometimes, if you don't have the emotional support, mawawala talaga yung breastfeeding practice, okay? What were the needs that were seen after that study? So there was a need, the need to institute appropriate interventions and enabling mechanisms to revitalize, to protect, promote, and support or sustain breastfeeding practices, especially within the facilities. Okay? Reassessment of previously certified hospitals to assess new ones and to continue capacity building of health workers. Ibig sabihin, in short, bigyan tuon ulit, buhayin yung inumpisahan noong 1992. Okay. Integrate mother-friendly indicators like positioning during labor and delivery, skin-to-skin contact, minimal use of anesthesia, and episiotomies, yung pagkakat. Masakit yun. I went through that. Umaray ako, umiyak ako, ha. Encouraging involvement and support of significant others, which made me very happy. Yung pala, tama din yung ginagawa namin to the woman before, during, and after delivery. Because tatay is a partner of, hindi naman nagkaroon tayo ng immaculate conception. Very active si tatay nung nangyari yun, Address emerging issues affecting breastfeeding. No? So nagbe-breastfeed na, we need to continually help the mother who is breastfeeding kasi na-challenge. For example, merong mga challenges ngayon. There are some places na they look down on breastfeeding. Di ba? Anybody has undergone discriminatory moments in some places because nag-breastfeed? Raise both feet. Okay, sorry. Both hands na lang. Di ba? That is sabi nga ni ma'am, you're right. And this should be respected, okay? So we need to address those issues. Okay. The aim of the Mother Baby Friendly Hospital Initiative is really to implement the 10 steps to successful breastfeeding and to end the distribution of free and low-cost supplies of breast milk substitutes to health facilities. Okay? Okay. Ito yung administrative order. Ito na yung binabatayan ng mandate namin na hindi kami ikukulong. Hindi tayo kukulong pag tayo nag-advocate ng breastfeeding. So, protected tayo ng batas. So, may Administrative Order 2007-0026, Revitalization of the Mother Baby Friendly Hospital Initiative and Health Facilities with Maternity and Newborn Care Services. And this aim to guide health workers. Remember, sa hospitals pa yung sinasabing wag mag-breastfeed, di ba? Yung kaninang nakita sa study. So we need to address this. Guide health workers in revitalizing the Mother Baby Friendly Hospital Initiative towards a sustainable action to protect, promote, and support breastfeeding. The objectives is to transform all health institutions with maternity and newborn services in both the government and the private sector and other health facilities into facilities that fully protect, promote, and support rooming in. Kaya dapat sa hospital, pag may yung dating mga sabing nursery, they're not nurseries anymore. We call them NICU, Neonatal Intensive Care Units. These are for the very sick babies who cannot even feed, kailangan tube feeding, mga ganon. Yun yung NICU na tawag. No more nurseries kasi dapat rooming in. And mother-baby friendly practices. Okay. Build the critical capacity and commitment of healthcare staff. This is critical, as the word says. Because even if you have the accreditation, we have seen that, you have the training and everything, if you do not have commitment in the healthcare staff in protecting, promoting, and providing support for appropriate infant and young child feeding practices, wala din. It will see again the decline of the breastfeeding initiative. Okay. Establish linkage with the primary healthcare facilities. Ano po ang primary healthcare facilities? These are your health centers, your clinics, these are yung frontline, these are the primary healthcare facilities. And community support groups to sustain the practice and ensure an enabling environment for optical feeding practices. When you say enabling environment, these are respecting your rights that has been mentioned, okay? That will be supportive to the breastfeeding mother, okay? Ito ang mga legal mandates, okay? One is the Executive Order number 51 of 1986. This is the National Code of Marketing of Breast Milk Substitutes, Breast Milk Supplements, and Related Products. This was a landmark legal action of government. Tinigil yung pagbibigay ng samples to healthcare workers, yung pag-promote ng breast milk substitutes. That's why nakita niyo wala na nga yung mga commercial. It was banned. Okay. This called for intensification of the dissemination of information on breastfeeding and proper nutrition, regulation of advertising, marketing, distribution of breast milk substitutes, and other related products including bottles, teats, prohibiting the use of health facilities and health workers in promotion, marketing of the products covered by the code. So, bawal promote ng hindi breastfeeding, ng mga kahit bote, yung mga pacifiers, okay. Another legal mandate, under Article 24 of the 1989 United Nations Conventions on Rights of the Child, which emphasize social responsibility of the member states to protect children and to provide them with appropriate support and services, emphasizing their right to the highest attainable level of healthcare services, etc., etc. So yun. Ang Pilipinas ay covered by this. So, hindi lang sa Pilipinas. Merong nagsasabi, Pilipinas, you need to institute this local laws that would promote and support breastfeeding. So, international mandate yan. Republic Act 7600, ito na yung sinabi natin kanina, Rooming In and Breastfeeding Act of 1992. Okay. Ito sinabi dito, rooming in, actually this has been modified already. Rooming in shall be observed within 30 minutes after birth. This is modified already dahil dun sa EINC, yung Essential Interpartum Newborn Care, which says that after the baby is delivered, the baby will not leave. Dapat naka-skin-to-skin contact for the next 1.5 hours. You do not take away the baby from the mother. So, automatic rooming in yun. Okay? And for normal spontaneous deliveries, breastfeeding should be done within 1 hour after birth. And for cesarean section deliveries, 3 to 4 hours after birth to ensure support. This has also been modified again by the EINC. Because even cesarean section mothers, we still do the EINC. Doon naman kami sa baba, wala nang pakialam dito sa taas. So ipatong na si baby din dyan. We do the EINC regardless whether it's vaginal or operative birth. Okay? To ensure yung principles of essential newborn care, breastfeeding included. Okay. Mas yung practice ng ENC na ito na tutumbok ito, it ensures support for early, exclusive, continuous breastfeeding. Okay. The Philippine Infant and Young Child Feeding (IYCF) policy as adopted from the WHO and UNICEF 2002 Global Strategy in Infant and Young Child Feeding calls for a renewed and accelerated action towards promotion of appropriate infant and young child feeding practices. I don't even know why they're still even doing commercials and using celebrities to promote substitute for a healthy, well-balanced diet. Di ba? Pag walang gana, bigyan mo nito. Instead of food, you give the substitute for food, which is contrary to this. Okay. PHIC, or this is the PhilHealth, circular number 26, circa of 2005, has included the Mother Baby Friendly Hospital Initiative as part of its accreditation requirement for hospitals in order to support, promote breastfeeding in primary, secondary, and tertiary, all levels of hospital facilities. And they recognize that breastfeeding is essential for the health and well-being of the infant and mother. So ito na yung teeth. We can only advocate and advocate, but if you do not have any teeth, kailangan minsan braso, no? Kailangan matigas ka, disiplina. When you're you're not within the law, patay ka, ha? Okay, so ito yon. You follow this, and everything will be fine. You will be accredited by PhilHealth. PhilHealth has the clout kasi sila yung nagre-reimburse. They are the insurance arm of public, of the government, di ba? So, sinasagot nila yung gastos din ng pasyente. So, if you are not following their requirement na maging breastfeeding or mother baby friendly hospital ka, you will not be accredited. The hospital or the facility will not be enlisted and will not be allowed to charge for PhilHealth reimbursements. Malaki yan. So these are the incentives. Mag-PhilHealth ka, you follow this. So breastfeeding support ito. Okay. Okay. The Administrative Order 2005-0023 of the DOH identified Formula 1 for Health as the implementing mechanism for health sector reforms, ensuring better health outcomes, responsive to public health system, equitable healthcare financing for Filipinos. Anong ibig po sabihin ng equitable healthcare? Okay. Equitable. We always hear equitable, equitable. Ano yung difference sa equal? Okay. Depende sa pangangailangan. Okay. If it's like, sorry ha, sa mga bansot ha. If this is the podium, okay, ako, abot ko na. So I do not need or maybe a little only, konti lang yung ibibigay sa akin na tungtungan para maabot ko yung mic. Ngayon, yung mas maliit sa akin, syempre, mas malaki ang ibibigay. Yan ay equity according to the need. Mas kailangan niya ng mas mataas na tungtungan kaysa sa akin. Same with healthcare financing. Equity. Yung kaya naman, syempre, hindi, bibigyan din siya, pero according to the need, yung kailangan lang niya. Yung mas nangangailangan, malaki pangangailangan, mas malaki din ang tutulong para maka-afford ng healthcare services. So this addresses yung mga poor and those that need really healthcare services. Okay? Para makuha nila the same services as those that can afford the services. So, malinaw po yung equity. Kasi kung equal, piso mo bibigay sa akin, piso din sa kanya, or yung binigay niyo sa aking podium, ay yung tungtungan, ganun din, bibigay mo sa 4 flat, hindi pa rin niya maaabot ito, di ba? Ganun yung equity. Okay. Another legal mandate is, tapos na to, 2005, ito na, tapos na. Okay. May mention tayong batas. These are administrative orders. Ngayon, sino po ang abogado dito? Buti na lang wala. Okay. But anyway, yung mga administrative orders na yan, may pinasang batas ang ating Kongreso at Senado. Ang tawag doon ay Section 18 of RA 1028. Ang sabi niyan, any health and non-health facility establishment or institution satisfying the requirements of these sections relative to lactation station may apply to the local government DOH for a working mother baby friendly certification. DOH shall promulgate guidelines to determine eligibility of certification, etc., and mag-i-inspect to confirm continued compliance with the standards. So, nasa batas itong lahat na pinag-uusapan. Hindi lang to administrative orders. So, kung makikipagtanong sa inyo, asa naman yung legal niyan? Puros administrative order. Hindi po, nagpasa po ang Kongreso. Bina-back up po ito. Ito po yung pundasyon ng ating pinag-uusapan. So, yung mga pinag-usapan natin dito, nasa batas talaga, no? We are not doing anything illegal. Protected ang mother. And this provides that magkaroon ng working mother baby friendly certification yung mga nagpa-practice ng proper lactation sa kanilang institutions. Okay? And this covers not only the hospitals but even the working places. Okay? So kasi we were talking about mother baby friendly hospitals. Kasi yung hospitals dun usually nanganganak, di ba? But what about sustaining the breastfeeding practices? Now we are requiring yung mga industrial places, even offices. Nakita niyo po yung malls? There are already spaces that says lactation rooms or lactation clinics where mothers can go and breastfeed their babies. Okay? May privacy doon. Okay. So, that is in support of breastfeeding. The objective of this Republic Act is to provide guidelines to health and non-health facility. See, non-health facility. Establishment or institution in applying or qualifying for certification as working mother-baby friendly workplace. So you have to be certified. You cannot just go into a place na baka kung ano-ano lang yun ang tinayo. The mother and the baby has to be protected. So these places are certified. They are inspected that this is a working mother-baby friendly place where she can breastfeed. Okay? So yung coverage noon ng mga administrative orders and those legal mandates, they apply to all government, private, and other facilities nationwide, especially in facilities providing maternal and newborn care services, regardless of the current certification. So kahit wala ng certification, you are still mandated to do the breastfeeding initiative. Kaya if there are health institutions especially that says, ay, pwede naman kaming makalusot, bote na lang, total, hindi pa rin sila lusot, even if they are not certified. They need to do it, okay? So they need to support, they need to promote, they need to sustain breastfeeding among mothers and the babies. Okay, ito yung mga definition of terms, just in case you go through this. The breast milk substitute that we were talking about means any food being marketed or otherwise represented as partial or total replacement for breast milk, whether or not suitable for that purpose. Complementary food, ito, means that it is any food, whether manufactured or locally prepared, suitable as complement to breast milk or to infant formula when either becomes insufficient or namatay yung nanay, walang ibang surrogate mother to breastfeed to satisfy the nutritional requirements of infant. Such food is commonly called weaning food or breast milk supplement. But this are specialized. That's why complementary food ang tawag dyan. Okay, it's also when you are introducing the babies to table food, that is complementary feeding already. Okay? Exclusive breastfeeding, syempre, breast milk lang, no? As the sole source of nutrition. Health workers, any person working in the healthcare system, whether private or government, whether professional or non-professional, including voluntary and unpaid workers in public or private practice. Okay, infant, alam natin, 0 to 11 months and 29 days. May isang araw na lang hindi na siya infant, 1-year-old na siya. Infant formula, ito yung alam natin okay? Breast milk substitute, formulated industrially in accordance with applicable codex, etc., to satisfy normal nutrition requirements up to 6 months of age. Okay, these are not encouraged. Lactation management, the general care of a mother-infant nursing couple during the mother's prenatal, immediate postpartum, and postnatal periods. It deals with educating, providing knowledge and information to pregnant and lactating mothers about the advantages of breastfeeding, the physiology of lactation, establishment and maintenance of lactation, proper care of the breasts and nipples, and such other matters that would contribute to successful breastfeeding. Lactation management. In Fabella, we formed a core group na walang ibang gagawin, iikot sila sa consultation dun sa prenatal area. So they counsel the mothers already on how to breastfeed. They're also very active immediately after the mother has delivered. Nag-a-assist sila kasi lalo yung mga first-time mothers. So, dinidispel nila yung mga haka-haka, old wives' tales to show them that breastfeeding is possible. And they go around in the ward supporting mothers. Kasi minsan mali yung pala yung latching. So, the mothers experience difficulties, for example, na sugat yung nipple. So, nadi-discourage yung mother to breastfeed. So, this lactation management group help her overcome and shows her the proper positioning para hindi na masugat yung nipple. Okay? Okay. Low birth weight infant, newborn weighing less than 2.5 kilograms. Rooming in, the practice of placing the newborn in the same room as the mother right after delivery up to discharge to facilitate mother and infant bonding and to initiate breastfeeding. Okay, the mother, okay, ito yung be placed. Ako, personally, I don't encourage the crib inside the room of the mother. Okay. The tendency is to put it in the crib. Lalo pag nakialam na si lola, lagay na lang sa crib si baby kasi gusto niya katabi niya. Diba? Ayun. Mga lola, lalo hindi na orient. Sorry, may lola po ba dito? Huwag niyo akong awayin mamaya. Okay. Skilled birth attendant refers to professional health workers such as a doctor, nurse, midwife, with a training or educational background to perform safe and clean deliveries. Okay, to become a mother-friendly institution, sino po dito ang may mga lying in? Taas ang kamay? Or a facility that caters to mothers? Okay. So to become a mother-friendly institution, the following are the required steps to be followed. This is in accordance with UNICEF WHO guidelines, okay? And merong manual naman. Okay. Okay. Sandali. So yun, ifa-follow yung steps sa Mother-Friend and Safe Motherhood Initiative. Also, you need to follow the 10 steps in successful breastfeeding. Okay. Okay. Ano yung 10 steps? We've been mentioning 10 steps, okay? 10 10 steps to successful breastfeeding. Who are familiar with this? Okay. Each facility providing maternal services and care for newborn infants should have a written breastfeeding policy that is routinely communicated to all healthcare staff. Ito written breastfeeding policy, usually it's a contract between the mother and the hospital. Pinapipirma ang mother. Okay? So may paper dyan na papipirmahan sa'yo. Ibig sabihin, the mother is also committing, and also the hospital or the the skilled birth attendant is committing to breastfeeding. Kontrata yon. Okay. Train all healthcare staff in skills necessary to implement the policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within half an hour, yes, because that's the time na nandyan yung baby, pahinga na siya, mag-feed na siya. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Yung mga naninikyu, yung mga babies na may problemang napupunta sa ICU, merong area doon na talagang ina-encourage pa ang mothers na pumunta regularly to breastfeed them. Like if they are in the incubators, they are taken out. But you know what? There's now a technique called kangaroo mother care na we are starting to implement to address yung technology of incubators. The mother is a very good incubator. Ang tawag kangaroo mother care. Okay? Okay. Give newborn infants no food or drink other than breast milk unless medically indicated. Practice rooming in to allow mother and infants to remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers. Ang tawag niyan ay dummies or suitors to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. Okay. So, mayroon ding kino-cover yung Executive Order 51. Ito yung milk code. We have discussed briefly already yung included dyan. To note included dyan. Refuse any gift samples offered by manufacturers or distributors as well as representatives of milk companies. So, bawal na ang mga milk companies and their representatives sa mga hospitals or mga public lying in, at least, no? Okay. Yan, may mga batas dyan. Never pass any samples or gifts to pregnant women. Okay. Refrain from accepting, ito yung code para sa mga health workers. Bawal sa amin ang mag-accept or avail of any contribution made by the representatives of the milk industry for fellowship, yung mga scholarships, study tours, research grants, attendance to professional conferences, and the like, intended for the health workers or management of staff. Okay? So, bawal sa amin magtanggap ng mga ganon or magpa-sponsor. Okay. Ensure that the health facility is not used for display, dissemination, and distribution of products of breast milk substitutes. Okay. Of course, we provide training. Yung National Lactation Management Training Center, ang Dr. Jose Fabella Memorial Hospital, and pwede rin dun sa mga regional lactation management training centers, usually yung mga regional hospitals na merong teams na ganito or training facilities for this. They offer the lactation management courses. Okay. Even for private health facilities, you can avail. Okay. Coaching and mentoring services shall be conducted by the regional coordinators, kami po yun, within 3 months after training kung nag-train ng lactation management program. Government and private health facilities providing maternity and newborn care shall conduct continuing education orientation on. We need to be updating ourselves, okay? Okay. So, the Dr. Josefa Belen Memorial Hospital shall continue to serve as the designated National Lactation Management Center for all government and private health facilities within NCR. Tapos sa mga provinces or regions, yung regional hospitals. Okay. Okay, assessment and accreditation process, merong tools dito para i-appraise yung sarili ninyo, kung kayo ay may facility. Ano ang kailangan ko para maging mother-baby friendly facility? So, nagpo-provide ng self-appraisal tool. Kompleto mo yun, then you can apply for certification. Okay, saan ka mag-a-apply? Sa regional office. Regional office. Bibigyan ka ng certification or accreditation. A plaque of accreditation shall be issued. Okay. Okay. Etong slide na to shows key intervention settings and services. Pinag-usapan natin yung emphasis was the health facilities. But breastfeeding or lactation management support can be done also in the family and in the community, in the home, di ba? After the hospital, home. In the workplace, we recognize this as areas where mothers should also be breastfeeding. So if you are working and your office is not mother-baby friendly to you, a lactating mother, pwede mong bigyan ng guideline na to. And then you can ask the help of the regional office to help them comply with the requirement because this is a law. Maybe they are not aware, okay, na there is such a law. Okay. Hindi pwedeng sabihin nag-iinarte ka lang. Arte mo lang yan, ikaw lang kasi nagbe-breastfeed. No, this is a law, okay? So they need to comply in working places. In the industry, even women who are working with industrial companies should have a lactation corner or a lactation room. In schools, okay. Okay. What is the mother-baby friendly care? Ito ay isang package not only for all those. So you have the mother-baby friendly hospital initiative. You have the Unang Yakap. I believe somebody is going to lecture on Unang Yakap. That's the EINC. The Republic Act, which is the Rooming In and Breastfeeding Human Milk Banking law. Executive Order 51 or the Milk Code. So these are our basis to support, sustain. Okay, ito yung certificate na makikita. Okay, maraming salamat po.